My name is Dr. Delia Garcia, and I wanted to share with you some of my thoughts about bariatric surgery, gastric bypass surgery. There are lots of terms for this kind of procedure that is often advocated for people that are overweight or obese as a solution to their obesity and associated problems. I'm a physician. I've practiced medicine for more than 30 years. I started my career in breast cancer. That was my specialty for 30 years. And then I left mainstream medicine to work to help people get to a healthy weight, eliminate medications, and reverse diseases related to obesity, heart disease, hypertension, diabetes, lower the risk of certain obesity-related cancers such as breast cancer, prostate, colorectal, liver, pancreas, and so forth. So I have been practicing weight loss and lifestyle medicine for the past 16 years. And I am really disturbed about surgery being recommended as a solution to overweight and obesity. It just does not make sense to me. Why don't we find something that works for people that are struggling with excess weight and associated medical problems? And that is what I have been doing for the past 16 years. I always think as an oncologist, if I had someone come into my office with a lesion on the top of their hand, on the dorsum of their hand, would I recommend an amputation for that small skin cancer? That would be insane. And yet we recommend surgery that has a whole host of potential complications and side effects for people that struggle with weight. And so I have been using a remarkable lifestyle program to help my clients and patients in the last 16 years, a program that has worked beautifully and therefore negates the option of surgery. So we know that obesity predisposes our patients and our clients to a whole host of medical problems. But what if we could help them select healthy food choices, and also we could help them with healthy lifestyle choices, better sleep, hydration, movement, stress reduction, relationships, all of these things, and then support them with weekly coaching, with a weekly webinar, with a Facebook support group where they could interact with other people that are on the same journey to create that vibrant health and add years to their lives. And back to bariatric or gastric bypass surgery, I always think of a young woman that I met several years ago. She was only in her 30s, and she was more than 100 pounds overweight. Her primary care physician recommended gastric bypass surgery, which she went ahead and had done. And it was done in a very reputable center. She paid, her insurance paid $28,000 for that surgery, but the complications that she sustained as a result of the surgery resulted in medical costs of over $3 million. You heard it correctly, over $3 million. She had malabsorption, dumping syndrome. She developed an infection. She had to have a feeding tube in for more than 2 years in order to get her nutrition under control. And in the meantime, her teenage daughter, who was about 14, was raising two younger children because her mom was in and out of the hospital. So those are the things that can happen. I've had a couple of patients where surgery was recommended for obesity who lost their lives, who died. And you can imagine why they would die. You know, they're carrying all this extra weight. They're predisposed to a heart attack or a stroke, and so forth. And I want to show you some pictures of a client named David. So David was all set up for bariatric surgery. That's what was recommended for his obesity. You see his before picture in the background in that white shirt. And but David was waiting to get approval from his insurance company to have the surgery. So in the meantime, he got started on my lifestyle program, and he had such great results with my lifestyle program that he ended up never having the surgery. He went on to lose 200 pounds and never had the surgery. The beautiful thing is that his stomach remains intact. He can eat whatever he wants. He can eat big salads. He can eat lots of vegetables. He can eat fruits. After gastric bypass surgery, oftentimes the patients are told to only eat protein because that's the only thing they can fit in that small stomach pouch. So they can't eat salads because there's not enough room there, and salads don't provide enough calories for them to heal and so forth. So again, I just want to make a plea to anybody out there who is recommending gastric bypass or bariatric surgery to their overweight and obese patients to consider something else. There's a lot of great programs out there now, and the one that I coach, I'm particularly enamored with because the results are extraordinary, and people get their lives back. They're able to get off medications, reverse diseases, and certainly lower their risk of things that shorten their lives. So thank you so much for listening, and please get back to the person who invited you to learn more about the lifestyle program that can help people transform their lives.